Okay, I'm back to respond to week 7, and I know that this is not the most fantastic video you've probably seen on YouTube, but I do hope to provide you with a bit of information. So first of all, I wanted to talk about Eastern and Western medicine. It's likely a good idea that if you blend Eastern and Western medicine, that you will have the greatest impact on your overall health. It's kind of similar to blending the organic and harmony approaches that are talked about in your book. I hope you had a chance to look at those images that I put online of my instructor when we went to China who did cupping. It's an interesting process, and it was even more interesting to see that done just right there in the apartment complex. So go ahead and take a look at those pictures. Of course, you can ask me any questions if you have any. Next, I wanted to say that just knowing the physical facts about an illness and treating them with medication is not always the best solution. If surgery is required, even people who are Eastern medical practitioners will tell you that their methods will not work if surgery is required. People experiencing pain, there might not be something physical to indicate where the pain is coming from. And this is why it is important to take into account all of the pieces of one's life that might be impacting their health. It might be anything. That's why we choose the biopsychosocial model, so we can implement and integrate people's biology, psychology, and sociology so that we can determine if something is a physical illness or a psychosomatic illness, or the new term, as the Mayo Clinic calls it, fictitious disorder. So my son likes to tell people, he's 6 years old, and he tells people he's a hypochondriac, because I call him a hypochondriac, because it seems like everybody in our house, whenever anyone gets sick, he's sick. Whenever somebody has an injury, he of course has the same injury. So it's kind of funny to see a 6-year-old walking around, actually he's not even 6 yet, walking around saying, I'm a hypochondriac. But you get the idea. If you're a healthcare provider and are trying to be culturally respectful, it will come across to the patient no matter how much or how little time you have together, and no matter how much you know about their culture or don't know about their culture. As long as you're trying to be respectful, they will certainly be appreciative. If a provider allocates his or her time wisely and plans ahead, it is possible to develop a relationship with a patient in a manner similar to those in the ideas of personalismo, respeto, and confianza. Trust and communication are extremely important aspects of communicating in healthcare. Because of the relationship between the patient and the provider, it's probably one of the most intimate relationships there can be between two people. It may not be possible to know everything about every culture, but being culturally aware and respectful will definitely go a long way to making patients comfortable. The blame game will not likely do anybody any good. When it comes to prejudice in healthcare, if you blame the provider or if you blame yourself, there's no resolution to the healthcare issues. However, if you give credit where credit is due, there may be a better way to tackle the issues. So just admit if there's something that went wrong or somebody did something wrong. It's much easier to deal with it this way than to not be as honest as possible in our dealings. You need to be your own advocate as a healthcare provider and as a patient. That is the best way to go about working in the healthcare field. And educating patients is always a good idea. Even if they don't want to hear the information that you're providing, eventually they will find that information helpful. The body mass index was brought up. Anybody know their BMI? It is definitely frustrating for numerous people because it doesn't take into account muscle mass or bone mass, and muscle mass weighs more than fat mass, and so the best that a person can be asked to do is to take care of themselves. If we're trying to do motivational interviewing, it would be hard for us to ask of others what we are not willing to do ourselves, and trying to follow a body mass index that doesn't fit for each specific person is going to be something challenging. Well, actually, I think that's all I have for my response to week 7, so stay tuned for my response to week 8, and have a great week.